20 years ago, most children with liver disease died during childhood. Now, because of medical and surgical advances, most of them survive into adult life. The transition from pediatric to adult services requires careful management to ensure these young people can make the most out of their lives.
Young people who've had a lifetime of chronic liver disease, when they approach the need to transfer to adult care, they have this normal problems of adolescence, of growing up and becoming independent, but they have in their background a lifetime of chronic disease, of hospital visits, hospitalization and medication. They often rebel against these constraints, and so this makes it difficult for our adult colleagues to take over their care.
Physicians treating young adult patients with chronic liver disease need to be aware of the diseases which affect infants, as they may be different to adult onset disease. These are biliary atresia, progressive familial intrahepatic cholestasis, Alagille syndrome, and metabolic diseases such as hereditary tyrosinemia type 1. In addition, children growing up with a transplanted liver may be challenging for adult physicians.
Young people who survive liver transplantation face different problems to young adults. They are likely to have had a lifetime on immunosuppression, that is anti-rejection treatment, and so they are more likely to develop renal failure, cancer, particularly skin cancer, and post-transplant lymphoproliferative disease. And they also develop a very curious condition called graft hepatitis, which leads to scarring and cirrhosis of the liver in adult life.
During this time, medical problems collide with the challenges of becoming an adult.
Adolescents are starting to try and get a sense of their own self. And in that can have their own opinions that might differ from their families, which can be difficult. And their adolescence can make them feel as if they are infallible, and so they take more risks. And sometimes they question the authority that is around them. And that's why it's important that we have a multidisciplinary team to support that process, to allow young people to be who they are.
Adolescents are neither older children nor young adults. For all of them, this phase of life is about achieving independence, developing their own identity, forming relationships outside of their nuclear family, and adapting to the hormonal changes that occur during this phase of life. Adolescence is typically characterized by a belief in one's own immortality, struggles with peer pressure, and a focus on body image. And contrary to earlier assumptions, the brain of adolescence is still developing.
Being an adolescent on its own can be very challenging for young people, and then when that's combined with a chronic illness such as chronic liver disease, that can make life extremely challenging for young people.
The disease itself, as well as the constant medical monitoring and daily medication, can have an impact on the young person's development, socially, cognitively, and in how they achieve educational goals. Their quality of life can be limited in many areas. Both the disease and medication can affect appearance, and sometimes unpredictable developments of the chronic liver disease make it difficult to plan for the future.
Chronic liver disease can make them extremely fatigued, for example, which can make it very difficult for them to join in with their peers and feel normal. If they have chronic liver disease, often they need to take regular medication, which can also be difficult for them in terms of remembering to take it at a regular time of day. But also sometimes their medication can make them feel unwell.
The transition process takes place during this critical phase, under the rules of the healthcare system. There may be rigid, age-related criteria that force changes to take place in the middle of critical developmental phases. The transition process is often mistakenly thought to be a single event involving the move from pediatrics to adult medicine. In reality, however, it is an active, dynamic process that begins early in adolescence and only ends when a young person has finally reached adult medicine.
The young patient with liver disease or post-liver transplant moving to adult services needs to take responsibility for their own lives and their own care. They need to take their medication regularly and attend hospital regularly. They need to participate fully in the process.
The transition journey must begin early enough so that the destination is reached in good time. It should be started at about the time of a young person's 12th birthday. The first step is to develop and define a plan together, with measured steps and realistic goals. Special features of the disease and individual maturity must be taken into account. It is best to wait for stable phases in the disease process and in the life course before making significant changes. The transfer of knowledge about the disease and its resulting impact on everyday life are crucial in enabling the young person to deal with their own situation. In order to convey this knowledge effectively, information must be age appropriate and appropriate to the individual's developmental stage.
A young person needs an appropriate level of knowledge about their healthcare condition and about how that affects their everyday lives. They need to know and understand about their medication, what they are taking it for, and how it may affect them. In addition, they need to know and understand the changes that occur in their own bodies during the process of adolescence and how that may have an impact on their long-term condition. The other important area that they need to know about is the difference between their paediatric healthcare services and adult healthcare, and the different ways in which they can approach people in adult healthcare for advice regarding their illness and more general lifestyle advice.
In addition to the necessary knowledge, young people with chronic diseases need corresponding skills to achieve an appropriate and autonomous handling of their life situation. This includes the ability to find necessary information on health issues and to distinguish between reliable and inaccurate information. It is crucial that they develop the ability to find their own way around the health system, to make and keep appointments, and to adhere to prescribed therapies. Finally, the ability to act strategically in emergencies makes the patient responsible for themselves and gives them independence. Transition can only succeed if everyone pulls together. There is always an interdisciplinary approach that integrates different groups. The focus is always on the patients.
The patients are clearly the key players in this process, but it's important to be able to provide them with the support that they need to be able to manage the transition successfully. And that's where all members of the multidisciplinary team come in.
Also, the parents play an important role. They have to find the right path and strike a balance between control and letting go of their child with a chronic illness, as with any child. That is what enables a young person to ultimately go their own way.
When we start transition preparation for children, we involve their parents right from the start. This is a difficult time for parents who need to let go of the care of their child, allow the child to care for themselves and for their adult team to care for them. They need to be involved right throughout the process, but many find it very difficult.
And of course, the medical and nursing teams are vital. They have specific responsibilities within their own field, but as with caring for any patient group with complex needs, it is the cooperation between teams that is so important, and this is particularly true when thinking about the transition process.
Transition is a complex process and it involves many professionals. It involves medical care, nursing care, psychological care, and social care. On our team, we have transition physicians, transition nurses, a youth worker, and psychology. We also have, if required, dietitians to support the young person through this process of moving from a very family-centered system to a self-care system in adult life.
To be successful, those involved have to communicate well with each other. A responsible contact person is useful to coordinate this communication and can contribute a lot to effective processes. At the beginning of the transition process, there should be a detailed clinical discussion as a starting point. Validated questionnaires and checklists can be useful to assess a young person's readiness to transition and where they are on the transition pathway. Training, including for parents, imparts knowledge as well as skills. Sessions can take place individually or in groups, and increasingly, there are more apps and online material which can help to support the transition process. In today's digital world, young people in particular have an affinity for these forms of media and can benefit greatly from opportunities to access information and support using these more innovative technologies. The path from pediatrics to adult medicine is inevitable, but there are many ways to smoothen it, remove hurdles, and make goals achievable.
The remarkable medical and surgical advances that have allowed children with liver disease to grow into adult life is a huge success for medical and surgical disciplines. We need to ensure that we transfer these children safely into adult life so that they are able to manage their own healthcare and contribute equally to society. This is essential, and we can do it, and it needs to be done.